Is working?
Yeah, perfect.
Okay, thank you. So good afternoon. I'm Sonia Ortiz. First of all, I would like to thank to the organizers for inviting me, and also I would like to thank to Óptica because the work I'm going to talk about has been done in collaboration with them. I'm going to talk about the effect of peripheral refractive error on driving performance. Okay. Driving is a very highly demanding visual task. It is estimated that around 90% of the information we acquire during driving is visual. Peripheral vision is very important for driving. It assists in important aspects such as lane keeping, steering control, or hazard detection. We know that when peripheral vision is affected by ocular pathologies such as glaucoma, restricting the visual field, it increases the accident risk. However, very little is known about the effect of changes on the peripheral optical quality on the driving task. There are interventions such as cataract surgery with eyes implanted with monofocal standard IOLs that increase or decrease the optical quality on the periphery. Eyes implanted with monofocal IOLs had increased peripheral astigmatism that importantly reduced the contrast sensitivity on the periphery. On the other hand, there are other interventions such as orthokeratology or soft contact lenses for myopia control that induce important peripheral defocuses. For these reasons, the objective of our study was to investigate the effect of different peripheral refractive errors on driving while performing secondary tasks. Also, an additional aim was to establish which test for evaluating the quality of peripheral vision could be a good predictor of driving performance. For this purpose, we included a sample of 31 young regular drivers with a mean age of about 24 years. All of them had a binocular visual acuity of at least 20/25, and they had spherical equivalence between plus minus 1.50 diopters. This last requirement was established in order to obtain peripheral refractions as homogeneous as possible. All of them undergone 7 experimental conditions. A baseline condition without inducing any peripheral defocus, and 7 experimental conditions after inducing peripheral defocuses. We induced these defocuses with spherical lenses of plus minus 2 diopters, plus minus 4 diopters, and we induced astigmatism with cylindrical lenses of 2 diopters and 4 diopters. We induced with the rule astigmatism. We induced the defocuses with a trial frame where we mounted ophthalmic lenses that had a central corridor that allowed sharp vision to the central to the nasal area, allowing around 30 degrees of central sharp vision. On one hand, we assessed peripheral binocular visual acuity and peripheral binocular contrast sensitivity. For this purpose, we employed a display located at the driving simulator at 40 degrees of eccentricity. Visual function was assessed for all experimental conditions. On the other hand, we assessed driving performance by means of a driving simulator that is represented on the figure. Participants had to complete on each condition a route that had 2 different sections, a dual carriageway first, and then a mountain road. At the same time, at specific points of the route, they have to perform secondary tasks that try to simulate normal tasks that we could do in a in-vehicle system. The tasks were performed on the same display as I mentioned it before, and they consisted, the first task consisted on searching a road traffic sign in a document, and the second task consisted of introducing an address on Google Maps. They were repeated at several points. From the driving simulator, we assess driving performance by means of different individual variables, such as mean speed, the total distance driving outside the lane, the standard deviation of the lateral lane position, the SDLP, that is a measure of lane waving. And from all of them, we calculated as a general measure of driving performance, the called overall driving performance score, with higher values indicating better performance. Okay, and let's go to the results. On this slide, we present the results of visual function assessment. We compared the baseline session with the rest of conditions, and as can be seen, peripheral visual acuity was significantly deteriorated for all conditions. Almost the same occurred for contrast sensitivity, that was significantly reduced for all conditions except for the myopic defocus of 2 diopters. On the figure at the bottom, we can see the percentage of deterioration for visual acuity and contrast sensitivity for all conditions with respect to the baseline. As can be seen, the more deleterious peripheral defocuses were the myopic and hyperopic defocuses of 4 diopters, and also the greater astigmatism. And here we present the results for driving performance for the route in general. That is, all the secondary tasks are included in this analysis. Data in green correspond to the dual carriageway, and data in orange correspond to the mountain road. Okay, on the dual carriageway, we see a significant decrease on mean speed for the myopic defocus of 2 diopters and the hyperopic defocus of 4 diopters, also for both astigmatisms. The total distance driving outside the lane was significantly increased for both astigmatisms, and in the mountain road, we found a significant reduction in mean speed for the higher astigmatism and higher standard deviation of the lateral lane position for the 4 diopters of myopic defocus and the 4 diopters of astigmatism. Here, we have the results for driving performance, but only for the moments when participants were interacting with the Google Maps task. We decided to do this separate analysis because we consider the Google Maps task as more visually demanding. And the results showed that mean speed was significantly reduced for the 4 diopters of myopic and hyperopic defocus and both astigmatisms. The distance driving outside the lane was significantly increased for the 4 diopters of myopic defocus and 4 diopters of astigmatism. And finally, the SDLP was significantly increased for the 4 diopters of myopic defocus. This can be seen on the figure at the bottom, on which we represent the increase on the SDLP for each condition. Finally, the overall driving performance score results are represented on these figures for the route in general on the left and the route when performing the Google Maps task on the right. For both conditions, the most impairment, the focus was the higher astigmatism, the 4 diopters of astigmatism. So the overall performance in driving was significantly deteriorated only for the higher astigmatism. Finally, as a final step, we wanted to study the relationship between driving performance and visual results. And we obtained a significant correlation between contrast sensitivity and the overall driving performance score for the general route. And the same correlation was found when participants were typing an address on Google Maps task. But in this case, we also found a significant correlation with visual acuity. So when they had worse contrast sensitivity or worse visual acuity at the periphery, they performed worse in the driving simulator. So as conclusions, we can say that induced peripheral refractive errors may negatively impact driving when performing visual manual secondary tasks, similar to those frequently performed in real driving. Participants in this study demonstrated poorer lane keeping performance, mainly for the 4 diopters of myopic defocus and the 4 diopters of astigmatism. The impairment generated in driving performance was associated with poorer peripheral contrast sensitivity for the route in general, but also with worse visual acuity when subjects were driving and searching an address on Google Maps. These results have implications for subjects whose peripheral refraction is deteriorated by several interventions, such as cataract surgery or myopia control treatments. In such circumstances, their visual ability for driving could be deteriorated, supposing a risk for their safety. Further studies are needed in order to obtain more information on this aspect and inform to the patients of the possible consequences of peripheral visual changes. That's all. Thank you very much for your attention. This is our funding, and if you want to have more information about this work, you have here the